that father's age, father का age भी उतना ही important है. Thankfully, some government hospitals in India, they do have IVF centers where the costing can be, much lower as compared to if we go in private sector. We're seeing a rising trend of fertility issues even at younger population nowadays. If your body is not in the right shape, if you are overweight, if you are underweight, if you have any endocrinal abnormalities, if you have autoimmune disorders, or any other medical disorder that may affect your fertility. जाते हैं मसल बनाते हैं अपना, और जब sperm count का बारी आता है तो many times we find बहुत कम sperm count या sometimes zero count also.
It's a pleasure to interact with you. Thank you so much for agreeing to do this. Before we start the interview, I want to give you a brief idea about why we are doing this, even though I've explained it on the email. So we make this content for a company called Subhag Health Tech. And we took our products to Shark Tank India, and we did very well. And ever since that, we've decided to try and destigmatize infertility in India, because we feel that women carry the unnecessary burden of stigma, pain, and rejection. Perhaps that might not be the case for some families, but the person going through that feels those emotions. And therefore, we thought this is a prime opportunity for us to talk with stakeholders such as yourself and try and show people that this is a medical condition, it's treatable, and that there's nothing to be embarrassed about or be guilty about. So that is us. For our viewers' benefit, would you kindly introduce yourself?
Yeah, so am I audible, Jamie?
Yes, you are very audible.
Yeah, so first of all, thank you for having me on this platform. I'm Dr. Sunita Arora, and I'm clinical head of Bloom IVF Center. It's a chain of, IVF centers across India. So I'm heading the Delhi unit of Bloom IVF Center, which is situated at Fortis La Farm Hospital in Greater Class 2, New Delhi.
Oh,
So I'm basically a gynecologist and a fertility specialist.
wonderful. It's such an honor to interact with you, because there are some questions that I really want to ask somebody as informed as yourself. Before we get on to the more difficult questions, would you kindly, in your words, tell us what infertility means?
Yeah, so infertility basically means that after 1 year of trying or having a fruitful intercourse, couple is not able to conceive. That's infertility by definition. But at this point, I would like to put in an asterisk that if the couple is on older side, then we don't wait for this 1 year to be over. Like the couple where female counterpart is 35 years or more, then after 6 months, we start investigating them, because there this definition deviates a bit, right? Otherwise, it is by definition for a year if the couple is trying and they are not able to conceive.
Right. Coming to age, women's age has been a big source of contributor in the infertility rate. However, does male age also impact fertility?
Yeah, that's actually a very good question, because most of the time, people feel that it's only the female age which is at fault. But it is very important to make our general population aware about this fact that father's age, father ka age bhi utna hi important hai. And if we go by evidence, what our science says, then there are studies jahan pe they have given 45 years as cutoff, whereas there are other studies where they say after 50 years of age. So, most of the studies, they support after 45 years of father's age, it starts having an impact on the child while the baby is in utero, right from there. And mainly it's the neurodevelopmental disorders, and even, some psychiatric illnesses like schizophrenia, even developmental delays. There are something called as imprint disorder, and you must have heard of autism. Autism is seen to be closely associated with increased father age. So it's important for us to know that yes, father's age does have an impact, especially if the father is more than 45 years of age.
Very interesting. So autism is not just related to the mother's age, but more to the father's age.
Absolutely.
Wow.
That's correct.
You mentioned imprint disorder.
Yeah, so here there are also genetic disorders where the IQ level of the child and the developmental delays are there. So it's kind of a neurodevelopmental problem which happens in the children with increased paternal age or father's age.
This is such good information. Thank you. I wasn't aware of this part. So, Dr. Sunita, infertility being a couple's issue, like many doctors and research papers say that it's a 40-40-20 breakup. Why do you feel, according to my interaction with many people, why is there more stigma attached to women than the male partner?
Yeah, well, so, it is like this in most of the developmental countries. And it's a sad part of the story that in India also, most of the population feels that it's the female factor. But if we go by evidence, it is, equally they are contributing. And when you sit in your OPDs as a fertility physician, then you will understand that equal number of, the male partners, they are coming up and they are having the problems rather than only the female counterpart. But this question, why females are, being blamed more? So it's kind of our society is like that, right? Plus, it is little unfortunate that in women, if we go towards the women's age, then they start losing their egg producing potential little early as compared to if we compare them with men.
Yes.
So after 35 years or so, the fertility starts declining. But then coming back to your original question, it's definitely a stigma more for females, and we need to make population aware about this fact that infertility is contributed equally by males and females.
Interesting. So 35 years for women is when you see a decline in fertility, and for male is 5 years.
Yeah, so in men, we can say even, 42 to 45 years, still say around 40 to 45 years of age, they do good as far as these neurodevelopmental disorders, increased chances of autism is concerned. But in females, unfortunately, after 35 years, the clock starts ticking. So 30 to 35 years that is why all fertility practitioners will say that is the right age you have to you should complete your fertility or preserve your fertility. So that's again a very important and beautiful part of fertility, that if you are not planning to conceive between 30 to 35, there is an option of fertility preservation for unmarried girls and for couples as well, right? So girls can freeze their eggs, and couples, if they are not planning to conceive, they can even freeze their embryos. So embryos is a combination of egg and sperm. So they can freeze it for future. So when they want to get pregnant later on, so the age will correspond to the age at which the egg or embryo was frozen, not to the age of, at that time when they are planning to conceive.
You
it is
answered
something
my question.
Again, yeah, and many people, many girls, they are turning up interestingly for fertility preservation nowadays.
Yeah, that's such an empowering move.
Absolutely.
Yeah. Dr. Sunita, I believe that fertility related stigma is across India, and it doesn't matter which sect of society you are from, it comes down to the family. I came across a couple where recently only, where they've been married for around 3 years, and the female was trying to get pregnant. She's not able to get pregnant. And so it's the female's problem all the time, right? So things reached to a point where they were planning on getting divorced. The male wasn't willing to get treated. And at last, after 3 years, after talk reached to the point of getting a divorce, the husband also agreed to go for a treatment. And that's when, after semen analysis, the doctor told the couple that it is the male's problem and there's like 0 chance of the woman getting pregnant because of semen issues. So things like that I'm sure you've come across.
Many times, for that matter. Yeah.
Yeah.
So I do agree with you. It is hard to explain sometimes to couples, to males, that you need to do at least a basic test called semen analysis.
Yes.
Because that if the semen analysis is not um, appropriate, or it is not showing a good number of sperms, then obviously we have to think of male contributing to the fertility. And there are cases of so-called azoospermia, जहाँ पे कि nil sperm होता है, zero sperms, and the families will keep on focusing only on females. So this is again something I'll say, that more and more awareness to population, more programs like the one you are doing. So more and more such programs for public awareness are definitely needed to make the population aware that even the male counterpart is equally contributing. And a basic test called semen analysis can reveal so many things about whether male is doing well or not.
Yes. And do you come across incidents where the male partner is reluctant to get tested for whatever?
Yeah, many times. This is what I just said, that, sometimes a doctor literally presses hard that this is the only investigation we are asking you for. What happens after the basic investigations are done for female, and then before going on to more invasive investigation for the female counterpart, you need to do a basic semen analysis. And many a times this happens that the daughter-in-law is brought to the OPD by mother-in-law and the son is missing.
Yes.
And then, it becomes difficult for the doctor. So, we explain to the mother that it is equally important before we start doing more invasive procedures on female counterpart, that a basic semen analysis is needed. But Jemmy, I'll tell you something, that I have seen a change in trend over last few years. People are becoming aware, and even, couples from peripheral areas or remote areas who were not earlier coming for treatment, they are coming up. So I will say that I can see over the past so many years a change, and males somehow have started coming forward for testing and all. But the problem still exists. The problem which you mentioned, it still exists in our society. But yes, gradually, I think it is decreasing.
Yes. So there's a positive sign, and it'll take time to filter down to the basic level. So which brings me to one of the questions that I've been wanting to ask someone. I learned recently that infertility is now termed as a disease and is covered by medical insurance. Now, where I'm from Nagaland. And यहाँ पे जो लोग होता है, many people will not be able to afford IVF, given that it's around 1.52 lakhs for one round. So how is it covered? Where is it covered? How do we get those information?
So see, you are right in saying that most of the insurance company वो cover नहीं करती हैं, fertility treatments को cover नहीं करती हैं, IVF को cover नहीं करती हैं. But for last 1 or 2 years, कुछ companies ऐसी हैं जो इसको partly cover करने लगे हैं. They do a capping in the sense that they will say that they will give say around 1 lakh capped amount, but not beyond that.
Okay.
So there are some companies which I have seen, they have done a capping for fertility treatment, but most of the companies, I'll say 95% companies are still not covering the fertility part. Also, these some non-affording couples and all. So thankfully, some government hospitals in India, they do have IVF centers where the costing can be, much lower as compared to if they go in private sector. But of course, there are long queues, and as usual, the workload is so much in government hospitals. So most of the people, they have to go towards the private sectors for getting treated on time. So this is a problem in India, and our assisted reproduction societies which work for reproductive medicine. तो वो societies ने government को approach भी किया है to make changes in these policy, and hopefully let's hope that in near future something positive will come out. And more insurance company वो cover करेंगी fertility को. तो ऐसा move चल रहा है. So let's hope for the best.
Yes. So it's there's a glimmer of hope. The couple of companies that you talked about who cover, albeit with the capping, could you mention those companies?
No, that will be difficult for me to mention those companies, but people can go online and look for it.
Okay.
There are, it is, yeah, they can easily find those companies online, those companies who are, and, I've seen couples who are working with international companies or international banks, they are getting their fertility, but then everybody can't work in international banks or international companies. So they can go online and look for those insurance companies which cover fertility partly or with capping. It is accessible on internet. They can do that.
Yeah, it is accessible. However, is it or in India for that matter?
Yeah, in India, yes, there are few companies, and if people go online, then they can find those companies.
So हमारा state जैसा है जो remote जगह है, is it available? Do you think?
That will be hard for me to answer whether in your state particularly it will be available or not. But yes, because see, if you can search for it right now also live. So if you go, so those insurance companies are working in those remote areas or not is difficult to say.
Yes.
So, but then, yeah, but that's the only way. I mean, like, I can't real. I wish I could have read about those companies, the list of those companies, which is, and probably I can share few names after searching online and share it with you, and you can pass it on.
And we can prompt in the video.
Yeah,
So there's a glimmer of hope. Information is available. Accessibility might be a problem. However, we are working towards it. That is such a promising step. Dr. Sunita, what, according to you, are the leading causes of infertility in male and female?
So, see, Jamie, one thing which I must say before I give you a list of causes of infertility, we are seeing a rising trend of fertility issues even at younger population nowadays. This is something of concern. And why it is so is most of the girls who are walking in the OPD, they they will give you a history of some addiction or other. They will give you a history of smoking. They may give you a history of consumption of alcohol. And I feel there is something in the environment, a lot of toxins and pollutants we are surrounded with. Because of that, probably at younger age, we are seeing like at 30, the reserves are gone down. So it is seen very frequently. So something, very alarming probably. Now, coming to the causes. So, when we say causes, then we have to think what all is needed to become pregnant, right? A good egg is needed, uterus, and a good body condition, right?
Right.
So, if your body is not in the right shape, if you are overweight, if you're underweight, if you have any endocrinal abnormalities, if you have autoimmune disorders, or any other medical disorder, that may affect your fertility. Coming to the uterus, if your uterus has some disease like tuberculosis, pelvic tuberculosis is so common in India, then that particular lining, जो uterus के अंदर की lining होती है वो affect हो जाती है.
अच्छा.
So even if the lady is making egg, she is not able to conceive, right? And then ovaries or eggs, the egg is not healthy. And also, as I said, we are seeing a decline in ovarian reserve at younger age. So the number of eggs that is decreasing. With age, it is obviously known fact. But nowadays, we are seeing increasing number of population के 28 साल पे 30 साल के ऊपर girls आ रही हैं जिनका ovarian reserve 0.3, 0.4, 0.5. So it is hard to, get eggs, good number of eggs in those girls. Plus, if you see the different part of reproductive system, then sometimes the tubes are blocked. Yes. Right? So tubes, again, the blockage of tube, most common reason in our country is tuberculosis of tubes, which leads to inflammation inside the tube, and वो tube जो disease tube होती है वो egg को carry करके uterus में नहीं ला पाती है. Right? Right. Now, these are the common things which I discussed for female. For males, again, smokers, their counts really go down. lot of alcohol consumption, then lifestyles, working, for long hours, long sitting hours, working continuously on laptops, or in other words, again, environment, the radiation exposure, and all those things. And in addition to that, something again which is very, very important is, building your muscles, going to gym, and they don't know that they are eating what they are eating. That is, they are given some powders which they are told will make their muscles, but actually sometimes there is steroid, there is androgen inside that, so that their muscles become good, but their sperm counts, they go down like this. सो दिस ऑल्सो, ये भी बहुत लोगों को नहीं पता है, जिम जाते हैं, मसल बनाते हैं अपना, और जब स्पम काउंट का बारी आता है तो मेनी टाइम्स वी फाइंड बहुत कम स्पम काउंट, या sometimes zero count also. And if you look at the muscle, the first question doctor is going to ask, do you go to gym? Are you taking gym products? So they will say, ma'am, that's just protein. But this has become like a trend, and if you stop these protein products which these men are taking, again, after a few months, some of them, they show a marked improvement in the sperm count. So this is again something which I want to bring to notice of general population, that be aware, you know, उसके लेबल के ऊपर नहीं लिखा होगा, but then maybe some steroid, some androgen is there which is shutting down the testes, because बाहर से जब testosterone आ रहा है तो testes testosterone बनाना बंद कर देती है, spermatogenesis होना बंद हो जाता है. And this is a very, very common reason we have seen in males. Apart from this, undescended testes hai, infections hai in the genital organs, and obstruction. So, but most of the times it is treatable by one method or the other. And I don't think it is in scope of this particular interview, so I'll not go in details, but most of the time by doing some procedures, invasive procedures, pumps can be retrieved. It is treatable.
So that's very new information, the correlation between gymmers and infertility.
Yes.
That's going to surprise a lot of people. Yes.
I know. I wanted people to become aware about this. And this is actually, again, I'll say this trend is on rise. And I don't know where it is going to take our general population to.
Right. Yeah. And actually, that leads me to, lately I see a lot of multi-level companies where they sell all these medicine, herbs, etc. And I've always wondered whether they're certified, what's in those medicines, what's in those drinks, whether they're safe to drink. So that could also be one factor.
Yes, that can be one factor, because we actually don't know what exactly is there in herbs. But being an allopathic doctor, I would not be the right person to say anything about any of the herbs actually.
Yes.
But still, when we don't know what is there, how does it affect different body parts, we should not take it. We should collect information about any herb before consuming it.